and welcome back to our #CArthritis event. I'm very excited right now to be talking to Alex Adrian-Hamazaki, an undergraduate student at UBC. Thanks for joining us.
Yeah, no problem. Thanks for having me.
Of course. So we'd like to start off by asking you to tell us a little bit about yourself and how you're involved in rheumatology.
Yeah, so I'm actually studying biochemistry at UBC. I'm a third-year student, but in the summer I got involved with a man named Dr. Avina at the Arthritis Research Center, or Arthritis Research Canada down in Richmond.
Great, yeah. And now you just presented a poster yesterday, so tell us about that.
Yeah, so my poster was looking at rheumatoid arthritis as a risk factor for what's called venous thromboembolism, or VTE for short.
Okay, and tell us about that. What is venous thromboembolism?
Yeah, so it's essentially a combination of two different conditions. One called deep vein thrombosis, which is the buildup of plaque in deep veins, like your deep leg veins or like deep arm veins, like veins that aren't like peripheral around your skin. And then it's a combination of that, and as well as a condition called pulmonary embolism. Sometimes these blood clots can dislodge and make their way towards like the lung system.
Right.
And of course, if there's clots there, you can have problems. There's an associated mortality risk with that.
Okay, interesting. And so, what was the research question for your project?
Yeah, so there was two primary research questions. The first one is there a risk, or is RA a potential risk factor for VTE?
Okay.
And if there is, what are the trends? Is it a downward trend after first year of RA diagnosis, or does that trend stay the same across the years?
Okay, and so what were the findings for that
Yeah,
question?
so we did a population-based study, so we sampled a huge population of BC residents.
Right, okay.
And basically, our first question was answered, and we found that RA indeed did have an increased risk factor, or increased risk for VTE, as well as PE and DVT. We measured all three of those.
Okay.
So following that, we went to our second research question, and we also found that, interestingly enough, in the first year after RA diagnosis, risk for VTE, PE, and DVT was the highest. Following that first year of diagnosis, the risk decreased over the first 5 years. But even after the 5-year period, individuals with rheumatoid arthritis still had an increased risk for VTE.
Okay, so I know that this wasn't the main topic of your project to understand like why that association happens, but through, I don't know if maybe through your literature review, you might have some insight to why there's that relationship.
Yeah, so there's been a lot of research coming out, and there's been kind of like a huge association between an underlying, or what's been thought as being an underlying inflammation and how that's affecting different risk factors. It's been implicated in various cardiovascular diseases such as heart attacks and strokes.
Right.
So some people have been looking at if VTE is also affiliated in a similar way, but this is the first study where a huge population was used and where like a really generalizable result could have been or was produced.
Right. Yeah. Well, that's exciting to have
absolutely.
that. And so, what was that? I'm curious to know. You said it was population based. Do you have a number of the amount of participants?
Yeah. We identified approximately 40,000 individuals who had rheumatoid arthritis, right?
Yeah.
And we matched them in what's called a matched cohort pair analysis. So we had approximately 40,000 individuals with RA, and we had approximately 80,000 individuals who did not experience RA.
Okay.
And those 80,000 individuals were taken from an even larger randomly sampled pool of about 2 million BC residents.
Wow. My goodness.
Yeah.
There is a lot of strength in having a participant size that big.
Yes, absolutely, yeah. And because it was sampled from the general population, it's we hope that the findings are very generalizable to the everyday individual with RA. Right.
And so tell us, sort of explain more about what are the implications of your findings for patients.
Yeah, so in the first year, as I explained before, the risk of developing VTE or PE or DVT in that first year of RA is really high.
Remind me what PE and DVT
For sure. Yeah, PE is pulmonary embolism. That's when the blood clots migrate to the lung veins.
Okay.
And DVT is deep vein thrombosis. So that's going to be the blood clotting of the deep veins.
Right.
Yeah. So in the first year, as we showed, in the first year of RA diagnosis, the risk of developing those was very high. But but we saw that downward trend. We saw that over the years those risk factors decreased. So it's one of the possibilities of why that happens is that patients are seeing doctors, seeing rheumatologists, and that they're taking their anti-inflammatory drugs, right? So as we kind of talked about before, it's kind of thought that a huge underlying inflammation is causing these complications. Complications like being VTE, PE, and DVT.
Right.
So really, the advice that I would give patients is that it's really essential that if you're prescribed an anti-inflammatory, that you really take it, because not only are you going to be likely reducing your RA symptoms, but you're also likely reducing your risk of complications such as VTE.
Yeah, absolutely, and there is, as we know, a lot of evidence that inflammation is related to so many other chronic conditions and issues.
Absolutely.
So yeah, definitely, and that would make sense that after that first year, you are taking treatment and your disease activity is hopefully managed a bit more, and then you're at less risk for these conditions you've been talking about.
Yeah.
Great. Well, thank you that you made something that sounded very complicated now just a lot more very interesting, and I'm able to understand it. So that's awesome.
Thank you.
So what I would be interested in knowing is, since you're an undergraduate student, what's next for you? Do you see yourself continuing in the field of rheumatology?
Yeah, absolutely. In the time that I've spent at Arthritis Research Canada in Richmond has just been absolutely stellar.
Right.
I've really enjoyed learning about the different inflammatory diseases, and it's deeply interesting to me. So I hope to attend medical school and possibly get maybe do rheumatology.
Wow, well that would be great. We would love for you to do that. As you probably know, there is not enough rheumatologists to patients that need them.
Yeah.
So yeah, and how did you sort of choose rheumatology as an area for you to do your undergraduate project on?
Yeah, well, I was lucky enough to just get an opportunity at ARC, and really they do a lot of, and Antonio does a lot of rheumatology work. So so it was really by chance that I wound up there. But I was lucky enough that I really find it interesting.
Well, perfect. Well, I'm happy to hear that. Thank you so much for talking to us about your project.
Yeah, absolutely. Thanks for having me.
Yeah, and now we'll ask Anita if there are any questions from our viewers.
In your research, was there anyone with VTE who ended up getting rheumatoid arthritis? Did you notice that?
Yeah, so that's a great question. We didn't actually look at that. How the project worked is that between 1997 and 2009, we identified patients who had recently developed rheumatoid arthritis. So that we used what's called an incident cohort as opposed to a prevalent cohort, which would have been people who had rheumatoid arthritis prior to the to our research period. So we didn't actually look at whether they had experienced or we didn't actually identify individuals who had VTE prior to that and then developed arthritis later.
And what is the most interesting finding from your research?
I think the downwards trend is really interesting, and that's really promising. That
So explain that, the downwards trend.
Yeah, so again, the downwards trend, how in the first year, in the first year of diagnosis with RA, the risk factors for VTE were the highest.
Right,
but
and
they
decreased.
Yeah.
Interesting.
Did you also measure the incidents where patients were including taking omega-3s, fish oils as part of their treatment?
So we didn't measure the impact of drugs on the study, because if we had an individual who developed RA and then started taking a drug or any therapeutic like that, if we controlled for those variables, that would have been what's called manipulating an intermediate variable, and that would have introduced bias into the project. So unfortunately we couldn't do that. But a future project that needs to be done is definitely the assessment of how taking these drugs like DMARDs or biologics, how taking those drugs affects the risk factor of developing VTE.
Right, absolutely.
Yeah.
Well, thank you for those great questions, and thank you so much for joining us today, Alex.
Thanks for having me again. Appreciate it.